Definitely, I will get vaccinated, and I will get vaccinated publicly. And I would recommend it to my wife and my three daughters that they get vaccinated when their time comes.
Hello, welcome to your trustworthy medical YouTube channel. I'm Dr. Derek Liao, and today's video we're going to review Dr. Anthony Fauci's latest interview about COVID-19 vaccine. So, stay tuned.
Howard, I'm really concerned. I'm concerned because the numbers that we're looking at as of yesterday and today, as you mentioned correctly, are record breaking. I mean, we have over 2,000 people who die each day. Yesterday, it was 3,000 people. We have not yet seen the full brunt of the travel and the family get-togethers socially with dinner and friends over Thanksgiving. Next week, you're halfway through. You're going to go right up until the beginning of the travel period of Christmas. And we're going to do the whole thing over again. We're going to have more people traveling. And instead of just having a weekend of the holiday, it's well over a week. It's Christmas, the week between Christmas and New Year's, and then New Year's. That means that the recommendation, as stern as this sounds, it's not insensitive. It's just good public health. Limit as much as you possibly can your travel. You must say that this may be the time that we're not going to gather with 15, 20, 25 people at a big dinner with family and friends, as much as the season, essentially, that's part of the season that we've traditionally experienced and loved.
You know, practicing physical distancing doesn't mean to stay away from your family. You know, in this Christmas, I would like to be with my grandparents, to say them Merry Christmas, give them a hug. But I don't do it because I'm really concerned that even if I don't have any symptoms, I could infect them, because who knows? I could have the COVID-19. And then I don't want to be the reason that they are away from me, like they pass away. I don't imagine myself living with that burden, you know, like knowing that just because I wanted a hug, they then got infected, they pass away. I don't want that for my Christmas. I feel better, you know, calling them, saying, hey, I love you, Merry Christmas, just using video conference, Zoom, Skype. I feel better like that, because I know that staying away physically is how I can protect them. And actually that gives me a relief.
The thing that impressed me the most the other evening when I was, catching a 5-minute flash on the TV was an ad showing a nurse coming out of an ICU completely exhausted, with a mask on, saying, please, do something, wear a mask, don't crowd. I just came out of an ICU where there were 25 patients in there that are dying. It was really a very powerful ad.
You know, actually, in my country, in Panama, since April, wearing a mask is a mandate. So you cannot get out of your house without them. But we as healthcare workers, we do struggle, because we try to save lives, but the best way to save a life is actually not in the ICU or the hospital. It's in the prevention. What does that mean? It means that we have to prevent new infections. And how can we do that? Well, we can do it with physical distancing, wearing a mask, frequent hand washing for at least 20 seconds with water and soap. Because it doesn't matter like how many beds there are in the hospital, how many doctors, how many nurses, respiratory therapists. If there's more patients than we can handle, it's actually it's a struggle, There's it has been a very long year with this pandemic. We are we are tired. What I mean tired is not only physically, emotionally, because it seems that it's not going to get over soon. Well, I know there's the vaccine, but it will take some time, because we have to vaccinate at least 70 or 80% of the population. And some people actually they have their concerns about the vaccine. So it's very difficult for us. If you really want to help the healthcare workers, do a selfishness act and wear masks. Practice the physical distancing. Hand wash. I know that we are exhausted of hearing the same thing all over the year, but that way, actually, you can also be a hero.
Firstly, can you remind people the difference between protecting from disease and protecting from transmitting disease? It remains a source of confusion for many people.
Okay, so it really is simple. The primary endpoint upon which the 95% efficacy was determined was based on the prevention of clinically recognizable disease, not asymptomatic, not infection without symptomatic disease. The secondary endpoint was protection against severe disease requiring hospital intervention. It was also a secondary endpoint, though it wasn't clear whether we could reach it, but we're still looking at that. Does it protect against infection? So, a typical scenario could be that someone is protected against infection, and certainly, if against infection, against clinically recognizable disease. But there's also a likely scenario where someone is protected against clinically recognizable disease, but they still have replication competent virus in their nasopharynx. Hence, by definition, they are infected. The question is, we don't know yet. Hopefully, data in a longer term follow up or subsequent trials will determine whether or not you have a significant inhibition of actual infection. The other thing that's even a little bit more complicated is that it is conceivable that you could be protected against clinically recognizable disease. You could, however, get infected, but the level of immune response that protected you from clinically recognizable disease would be enough to lower the titer of the virus in your nasopharynx such that you would not be infective. So you could be infected, but not have enough virus in your nasopharynx to transmit it. So we don't know the answer to those last two questions.
This is a very important point. Why, after we get vaccinated, we still need to wear a mask? Because actually, we don't know the answer. We need more data.
Well, we know from influenza that the efficacy point in influenza is not measured by whether you get infected with influenza. It's measured by whether you sought medical care. So when you see an influenza vaccine that among people between the ages of 30 and 59, how effective it is, the number that you see is the number that protects them against getting infected to the point of requiring some medical attention, like going to the pharmacy and getting an anti-inflammatory and antipyretic. So many people who get protected from influenza don't necessarily get protected against infection.
Well, this is the reason that the first vaccine, the first doses that we get, we are going to target them to high-risk population, because we want to avoid these people to go to the hospital and die. We want to avoid, to saturate our healthcare system. That's why the first doses of this vaccine goes to elderly people and the healthcare workers that are in the front line.
Reports out of the UK around allergy, that wasn't discussed very much in the document, or even yesterday. It has not shown up in the United States in the Pfizer trial. And I didn't know if you have any sense about that, because I'm concerned that it can be used as a way to alarm people so that they will not get vaccinated. Do you have any sense about that?
Yeah, as you know, there were two cases in the implementation of virus of the vaccine study. I think people need to realize, and this is in some respects a good lesson for people to understand that safety considerations go well beyond the clinical trial.
Yes, actually, in the UK, when they started putting the vaccine, getting the shots, two healthcare workers had an anaphylactic reaction. What does that mean? Is they have a really, really intense allergic reaction that they can get swollen. Maybe they can have some difficulty breathing. But these people, they already had a past history of anaphylactic reaction. So we didn't know that that could happen because actually, as Dr. Anthony Fauci said, in the trials, in the 44,000 participant trial, they excluded from the population people with allergic reactions. So now that we know this, we can be alert. People that has a past history of anaphylactic reaction, they shouldn't take the vaccine if they are not in a healthcare facility, like Dr. Anthony Fauci said, because if they have a very high allergic reaction, there's no way that somebody can help them. But if they are in a hospital, for example, obviously there's going to be doctors, nurses, and the medication that they need. So for now, this population, we have to be alert what happens. And this is one of the reasons that for example, these vaccines is not targeted to people less than 16 years old or pregnant women, because the trials that they didn't include this population. So we don't know what can happen with them. Maybe nothing, but we don't know. If we don't know, we are cautious.
When do people outside of healthcare workers and the elderly, when do you think they'll begin to have options around being vaccinated?
Yeah, end of March, beginning of April.
Okay. I believe President-elect Biden will be the seventh president that you will advise. What's that been like, Tony?
Well, it's been a very interesting journey. Ronald Reagan had no idea that HIV would have an impact on his legacy, on his presidency. George H.W. Bush did, and that's why he was one of the first to try and say, we really need to do something about this. Clinton continued it. George W. Bush had no idea that in the first year of his presidency, we would have 9/11, followed by the anthrax attacks, which would trigger us to develop a major medical effort against bioterrorism, which really transformed into an effort against all emerging diseases. So our really core effort of how we respond in pandemic preparedness, that started off in George W. Bush's presidency. And then President Obama, he comes in and you have Zika, Ebola, and pandemic flu. 1, 2, 3. So that's what I mean by an interesting journey. I had written about my experience with 5 presidents, and when I got to Trump, I had a slide that said, what next? In the lecture that I think I says, what's next? We don't know. I mean, who would have predicted that a pandemic of historic proportions like we haven't seen in 102 years would totally dominate the last year of a presidential administration?
In medical school, they teach us a lot of the human body, pharmacology, diseases, but we don't get taught about how to communicate in public. And within this pandemic, I feel that Dr. Anthony Fauci has has gained the trust of the general population because of the way that he speaks. You know, when you hear him, you feel like he's being honest. You know, he's not lying. He's not trying to hide anything. He's trying to tell you the truth. If the things are going bad, he's trying to tell you. If things are going to better, he says that. So actually, just like Time magazine said, like for this 2020, he's one of the guardian of the health, one of the most respected characters of this year.
Well, I want to hear what Dr. Fauci will say. Will he be vaccinated? Will he recommend the vaccine for himself? Would he be vaccinated? And would he recommend the vaccine, the immunization for himself, his wife, his children?
Having looked at the process by where this vaccine and how this vaccine was tested, the evaluation of the data by the Data and Safety Monitoring Board, the intense scrutiny given to the data by both the career FDA scientists and the VRBPAC Advisory Committee, and knowing what I know personally, having gone over the data, definitely I will get vaccinated, and I will get vaccinated publicly in order to show that, in fact, I am willing to get vaccinated. And I would recommend it to my wife and my 3 daughters that they get vaccinated when their time comes.
If you want to watch the entire interview, you can click on this video. Don't forget to subscribe, give a like, and happy holidays. See you later.